Okay, hello everyone. I would like to welcome DaVinci and specifically Little DaVinci. We have Dr. Han here who is going to be presenting and talking on the creation of Little DaVinci. He is a pediatric kidney specialist at Children's Hospital in Dartmouth and is also the section chief there and the integrative med specialist. So we would like to welcome Dr. Han, and I'm going to give you the platform, sir.
Super, thank you. Well, thank you guys for having me talk and come out and discuss this today. And I'm going to run through a whole bunch of things about Little DaVinci, what we're doing, why we did it. One of the things I really believe strongly in is the why. I can put up slides and stuff, but I think most of this is for me to sort of give you guys the whole rundown and have you understand what's actually happening with everything. Can you guys hear me okay? Everybody got me okay? Yeah, okay, good.
Yes, sir.
Beautiful. So just as mentioned, I'm the pediatric nephrologist. I'm a pediatric nephrologist, and I'm also an integrated medicine specialist. And a lot of people always say to me, well, Matt, how did a pediatric nephrologist get into dealing with integrated medicine and supplements and herbs? And my story is like a lot of people's stories. I finished my fellowship down at Children's Hospital in Boston. I ended up going up to Maine Medical Center to help build what was then the Barbara Bush Children's Hospital back in the mid-90s. They didn't have a nephrology section, so they had me come up to do it. So I get up there and I'm working away, and I worked really hard for a few years, and I ended up getting sick. So I ended up developing a severe arthritis, and I ended up in the hospital for a while. And during the process, they kept trying to figure out why it was happening. And it turns out I'm HLA-B27 positive, and that predisposed me to have this arthritis. And they kept trying to find a reason. Back in the 90s, nobody was too hot on this whole concept of, you know, stress and integrative medicine. And I knew what it was. I knew I had worked 700 and something straight days. I had flown out to give a talk at the transplant meetings. And that triggered it. I knew this triggered it. And so it took me about, they put me on meds and I was doing okay, but it wasn't going great. And so I decided I needed to take control of my life again. And one of the big things you hear from patients who are dealing with disease entities is they feel like there's no control. The lack of control is sort of a universal phenomenon in patients who come into the healthcare system. And on top of that, I also feel like balance is very important. And in the Chinese medicine world, this concept of balance is really their symbol of medicine, the yin yang or yin yang symbol. They feel when life is out of balance, your disease is out of balance. So when your disease is out of balance, your life is out of balance. All this is going to get to why we're doing the supplements. Just hang in there. And so, and that was what sort of happened to me. My life became very out of balance. And as we say in integrative care, your genes load the gun and your environment pulls the trigger. And my environment was what I was going through. So I decided to take control of it after about 3 months and started doing some gentle exercise. I changed my food around. I started looking at the stressors I was doing. I changed my martial training from being this intense martial training to slowing it down a little bit, mostly because I had to, because my joints hurt too much. And before I knew it, I started getting better and better. And the foods I was eating, I was targeting foods that I thought would help to heal me rather than just eating ice cream all day long because I was feeling bad for myself. And over the course of the next 3 months, I started getting better and better and better. And sure enough, I went to my doc and I said, hey guys, I think I'm getting better. And they're like, and I said, I think it's because of these things I'm doing. And they're like, yeah, maybe, whatever. You know, back in the mid-90s, nobody put a whole lot of stock in it. So I said, well, I am. And after about 3 months, I was off all my meds, and I've been, knock on wood, I've been in remission now for 25, 30 years. And I was sort of in this weird place because I'd always looked at medicine a little differently, even though I'm trained as a traditional nephrologist and what have you. But I'd always seen patients more as having more health than they did disease. And I had a hard time trying to figure out how to get people to see this. But I realized I had this sort of internal conflict. Do I now tell people about this? Do I do something with it? Or do I just say, well, just, you know, grind out patience and see how things go? But I couldn't do that because internal conflicts don't work very well for people. And so I talked to a friend of mine who had just gone out to Andrew Weil's program out at the University of Arizona. And he was one of the first people. It was, the fellowship had just opened up. Sorry, I'm just silencing my phone here. It's my pager too. So, so I went out to, and I said to him, I said, Craig, I said, how do I do this? You know, how do I tell people? How do I teach people about this? And he says, well, just do it. And I said, well, I need something else. And he says, well, why don't you go out and do the fellowship? And in 2006, I entered into Dr. Weil's fellowship. At the time, there was only 3 of us, I think, in the country that were actually pediatric specialists. One pediatric pulmonologist out of Stanford, another developmentalist at the University of Arizona, and myself. And about 10 pediatricians in the country that had really gone through this training. We were actually the first full class that they had out there. And it was life-changing for me. It got me seeing the world differently. It got me seeing how to really embrace health and wellness as opposed to just treating disease, which is what we're trained to do in Western medicine. But one of the big differences was I was nestled in the midst of academic Western medical centers, and I'm a pediatric specialist in the midst of this other world. And so it was important for me to try and spread this word while I was in the middle of I always call it going into the lions then. So, and then to add to that, I started taking care of a young lady. And some of you might have actually seen her. She was a young girl who was born with mermaid syndrome. And we were on TV a lot. If you've ever watched the Discovery Channel or the Learning Channel or Oprah Winfrey or 2020, we did a bunch of documentaries and stuff with her. And she wasn't supposed to survive. She had the single worst disease that anyone's ever had. No one's ever had her severity of the disease and survived for more than a day or two. And she lived to be 10. And we did a lot of things with her. You know, we did kidney transplants and what have you. But the reason she lived so long really was because she never thought she was sick. I'd look at her, and her name was Shiloh, and I'd say, hey, Shiloh, you know, how you doing? Good. She says, Matt, why you got 2 legs? And I'd say, well, Shiloh, that's how God made me. And she'd say, well, that's great. Get me out of here. I got to go to dance class. Now, this little girl can't even stand, okay? But she danced like you wouldn't believe. And at that point in time, I realized that if this little girl who has the single worst condition in the history of the world doesn't think she's sick, well, then how can the rest of us think we're sick? It really came to this basic concept of wellness in the human spirit. And that if we look at all the wellness we have and we promote the wellness and not focus on the disease, we by definition will help people to be better. So that led me to doing more and more with integrative care. And but one of the big things that came up in integrative medicine is this concept of supplements and herbs, particularly in the pediatric realm. Because just like when I started this in 2006, and there wasn't ever any people that were out there that were doing integrative medicine in pediatrics, there also wasn't a whole lot of supplements, and there wasn't a whole lot of good supplements. So the term pediatric commonly was used as a marketing tool. And I'm not trying to be negative about other people. I'm just saying that it would be called pediatric with the idea that, oh, we'll sell more to kids because it's pediatric. But it really wasn't being based on what the data that was driving the therapeutic interventions. And as someone who was spending their time in, lecturing at, major medical centers on how to do things, to be able to say to people, yes, this supplement is good, or this one has the data on it, this zinc or magnesium or whatever it might be. Yet when you looked at what was being put in the pediatric supplements, it was either not described, it was not, it wasn't therapeutic based on the data, or it was filled with stuff that you wouldn't want your kids having. And it was a real problem. And I had talked with DaVinci in the past because I knew one of the people, the chief science officers that were there. And we got going on about these different things. But I was sort of torn because quite honestly, do I do this or not? Was I ethically doing the right thing to start creating supplements? Or was it better for me to say, no, I don't want any conflicts of interest or what have you? But then my nurses kept, let's face it, I've been very fortunate in my life. I've had some of the greatest nurses ever, and the nurses do all the work. I always say, I just walk around and talk, and they do everything, okay? But they were stuck. And they were stuck because we have probably one of the busiest pediatric integrative medicine programs in the country. Where, at the last place I was at, we are seeing 15 patients a day, where we were doing tons and tons and tons of work. And we had patients coming to us from all over the country. And yet they would go out and they would go to buy their supplement, and they would call the nurse back and say, I bought X. And we'd say, well, what's in it? And they would read us the ingredients, but none of the ingredients, they were all proprietary blends that didn't have any dosages on them, or had one big dosage, but didn't tell you how much of each individual thing was there. Or they were filled with sugar, or they had nowhere near the proprietary, the therapeutic dose that we were shooting for. And they were being charged huge amounts of money for this. So somebody would go in and get a $150 bottle of something that, for their child with ADHD. And then we look at it and go, well, it doesn't have therapeutic this, it doesn't have therapeutic this, it doesn't have therapeutic this. You should go out and get something else. And the parents were getting so angry and frustrated, and my nurses were getting angry and frustrated. We always listed it out in our care plan, but they got more and more frustrated because parents, not exaggerating, were spending thousands of dollars on supplements that we would not have recommended. And there's a misconception that pediatric dosing is dramatically different than it is in adults. It's not. As a matter of fact, very often the pediatric dosing is the same, and even sometimes more than it is in adults. And so we had to come up with a way to make this better. But the nurses came into me and said, Matt, we're done. You got to do something, okay? You have to fix this problem. And I said, so now I have another ethical dilemma. Knowing what I knew, did I fix the problem or did I not, okay? Was it more ethical for me to knowing the right thing to do and go make it better? Or was it more ethical for me to say, no, I don't want to have any conflict of interest? And, I always believe that, as Lao Tzu was asked one time, how do you survive in a non-virtuous world? His response was the only way to survive in a non-virtuous world is to be as virtuous as you possibly can be at all times, and then everything will be okay. So I said, okay, from a virtuous standpoint, I have to try and fix the pediatric supplement industry. And I know I have these grandiose ideas, but that's just what I thought. So I talked with the team from DaVinci and I said, okay, guys, here's what's going on. And this is the why. Everything comes off the why. The what and the how, we can always figure that out. But why we were doing it was the most critical piece. And that was that the pediatric supplement industry needs to be fixed, period. And so it has to have therapeutic dosing. It has to taste good, okay? And it has to be in a form that the kids can take it. If you're giving kids tablets and they can't swallow them, it doesn't do any good. So we worked off of this concept. And then, so I went and I took all the studies and we said, okay, what are the big things that kids are dealing with every day? What are the kids that we know are literally in epidemic proportions in our society? We knew anxiety, we knew depression, we knew insomnia, we knew headaches, we knew attention deficit hyperactivity disorder, we knew autism. These numbers are off the chart. You have 30 to 50% of kids dealing with anxiety. You have 40% in some cases dealing with insomnia. You have chronic pain phenomenon now at about 35 to 40% of all children, okay? 35 to 40% of all children right now are having pain more than 3 times a week for more than 3 to 6 months. It's staggering. It's just an unbelievable number. It's reaching adult proportions. So what we said is, all right, how do we do this? If we can come up with things that will help about 85% of the kids that we see that people see in the office, or conditions that are seen in the office, what do we need to do to get that to work for them? And so I went out and pulled all the data and I said, here's the things I need, guys. I need an omega-3 fat that will reach a therapeutic dose, not a gummy that has, and again, I'm not downplaying any of these other companies. I'm just telling you, if the therapeutic dose for omega-3 fat is 1,000 to 2,000 milligrams a day, and 5 gummies have 50 milligrams in them, or 100 milligrams in them, you have to eat the whole bottle every day to get a therapeutic dose. And parents were coming in and they spend a lot of money on these. And yet the other ones didn't taste good. You know, the regular fish oil liquids didn't taste good and they couldn't swallow the big pills. So I said, I need this therapeutic dose and I need it to taste good. We talked about zinc. Zinc is a common one used for ADHD. We need to get a therapeutic dose in. The tablets are really good if you can swallow them, but a lot of the other lozenges or a lot of the ones that came in the ADHD preparations had only a handful of milligrams of zinc when we knew the data. And we brought all the articles, we brought all the studies that were done, and we laid them out and said, we need a minimum of 20 to 50 milligrams to be able to be reached every day. If we looked at the headaches, butterbur is one of the best herbs out there for treating headaches. We know that works. We know it's effective. But the problem is the preparation was only in pill forms. So if I had 8, 9, 10, 11, 12-year-olds that can't swallow pills, we couldn't use butterbur. So I said, I need you to make me a liquid or a spray butterbur that tastes okay and that comes at least with 50 milligrams per dose. So we did that. Broccoli, okay, you guys probably heard about this with autism. We have 1 in 60 kids being diagnosed with autism. And Mass General and UCSF Stanford both did some case reports, case studies that showed broccoli extracts or sulforaphane actually help to improve autism symptoms in certain kids. This isn't, you know, Joe's Pizzeria making this up. This is, you know, this comes from a real place. But there was nothing on the market. We had nothing that was on the market and nothing on the market that was sulforaphane that tasted good. I said, so here's the study. This is the dose I need. Okay, it can't be some mixed thing. This is what I want. And so we made it. And so we prepared that. So we looked at things that were necessary. We looked at things that were needed. We looked at things that would meet the needs of the patients, that would handle it for almost all kids. We based it on data. We sent everything out for third-party certificate of analysis so that we would make sure that it was good stuff without anything bad in it. And we wanted it to taste good. And so by doing this, we're trying to change the whole concept here. You know, probiotics was another one. When we first started doing this, a lot of the kid probiotics, particularly the baby ones, didn't have very many colony forming units in it. People would buy them and say, oh, look, I got this liquid probiotic and it's awesome for my baby who's got colic, which it works great for colic. And we use it for kids that have to go on to antibiotics. But it had 100 million colony forming units, which sounds like a lot, but is nowhere near what we need. Or it might have 1 billion colony forming units, which again would not reach what we needed. So we came up with a chewable tablet for older kids, and we came up with a powder that only a tiny amount could reach over 3 billion colony forming units for the babies, and which is really what we're shooting for. So moms who are breastfeeding, for example, could just put a little bit of breast milk and put it on the areola so the kid could latch on and get it that way. So we tried to create things that were really driven for patients, that were driven by data, that were not sort of proprietary blends to mix and match and just make everything look nice so parents are fooled into believing that they're getting what they need, and actually give them what is done based on the data that's out there. So that's been the goal behind Little DaVinci the whole time. So we started doing this. We've had to modify things mostly because of taste. Okay, we had to modify the sulforaphane a little bit because we couldn't get it concentrated enough, and then we had to modify a few of the other ones so that they tasted good. But the same with L-theanine, another great one. You know, we looked at L-theanine as a nice anxiolytic herb. And there were some chewables out there. There were some tablets that were out there, but we made a fruit punch flavored spray that has a therapeutic dose. Again, I'll go back to that again and again and again. I've had so many parents come in and say, oh, we got something that has L-theanine, but it has a tiny amount of L-theanine in it because it's listed as a pediatric dose. That's not what we were shooting for. We wanted people to get what they needed that was therapeutic and would work for them. And so ultimately, that's how all of Little DaVinci started to develop. And we put this together and we've worked to try and get the word out. My job is to get beyond just working with functional medicine docs and naturopathic docs and chiropractors and what have you, and even just working with parents. I mean, we work with the parents a lot. But my job is to actually get this into all of Western medicine. So for example, here I am at the Children's Hospital at Dartmouth, and we are now starting to create what is going to be the first actual integrative children's hospital here. We are now looking at having somebody trained in every single practice, in every single division, in every single component of the Children's Hospital at Dartmouth, inpatient, outpatient, everywhere. So that when we're done, we'll have a model to show the world how we can do integrative care. But again, that makes it critical that I have to have good products. Because it's one thing to try and sell it to people who just naturally believe it's okay. And it's another thing to take people who are at Ivy League programs and say, you should use this. And they always look at me going, really? Why? Okay, show me the data. Show me that this works. And how do I know it's a good product? And so we've made sure that we went out and do third-party COA on all of the products, certificate of analysis. And we're looking at our labeling now. And I don't know exactly where this is with Tammy and Brandy yet, but this has been the next step we're looking at, is that every time somebody buys a product, wherever they're getting it from, they'll actually be able to get a link to that third-party COA, so that if it's a doc or a family or whatever, they'll know what they're getting. They can know that every time they buy that product, they're getting a good product. And we're hoping to push this. And if nothing else, I'm hoping that we sell lots of it so that people get good stuff and it helps them and they do really well. Because we've targeted things that all the kids are dealing with right now. We talked about anxiety, we talked about insomnia, headaches right now. Up to 20% of young girls are having headaches. 5 to 10% of them are having headaches almost every day. ADHD is 1 in 20% of boys right now. 55 to 80% of parents are looking for something besides just medications for those treatments. Okay, we know this, the data is very clear. If you have one of these conditions, the vast majority of the population is looking for something outside of just the Western medicine therapies. So we know this is out there. So our job is going to be to try and get this so that everybody gets it, everybody gets a good product, everybody feels comfortable with what they're doing, and in the end, force everybody else to do it, okay? Because if we do it, then everybody else is gonna have to do it, or they're not gonna be able to, do the right thing here. So yes, the products being sold is important, but more important to me, and it's been more important to me all along, I know this makes and our team is very much on board, even though I know they want to make sure we sell our product. But this concept of pediatric healthcare change is what our goal is. Our goal is true pediatric healthcare change, both from a supplement standpoint and from the standpoint of what we're doing within our, what I'm doing out here at Dartmouth. We actually were really close. Just before COVID, we had already put the teams together. We were ready to start all the educational programs, and then COVID hit. And then because I'm the only pediatric kidney specialist in New Hampshire, and at one point all of Vermont, they told me I got to work from home because I got sick. They didn't have anybody else left. And I was like, all right, so I could go in intermittently. So it sort of slowed everything down. I know it was good for supplement sales. We had a lot of supplement sales because everybody's looking for zinc and vitamin C and what have you. But the biggest part to this, though, beyond the sales, is what did COVID tell us? First of all, COVID told us that all the things that we just talked about, the ADHD, the anxiety, the insomnia, the belly pain, all of those factors went to another level. So we knew they were there, but they became so right in our face. I say it basically removed the curtain of what was going on in the world, and it really brought it all out. But it also brought out an even greater point, and that is that health is the greatest way to get past the pandemic. Vaccines are great. I love the COVID vaccine. All these other things are great. But the single best way for us and our children to get past these events is by being healthy people. It's what helps us to do better no matter what. And so that's going to be the next impetus to get all these integrative programs going, but also to help improve with our supplements and our sales and expand our lines and what have you. So the bottom line to the Little DaVinci thing is why we did it. And then we looked at specifically things, the vitamin Ds, the standard stuff, the vitamin Ds, the melatonins for sleep, the B vitamins, because we know B vitamins tend to be low in patients who have neurobehavioral issues like ADHD and autism. We targeted things like the sulforaphane and the liquid butterbur because they were not products that were actually on the market that were needed. They were liquid forms that kids could take and that tasted good. And we looked at the L-theanine for the calming nature of it, the magnesium, both from a GI standpoint and also from the calming nature and from the headache standpoint. So we tried to really look at this, a set number of products that could be used to go off and help the largest number of children and have them be good. So I'm trying to think of what else to tell you about that. I think that's the biggest part. Okay, Amanda.
I mute myself there. Yeah, I have a couple of questions for you. One
Sure.
of them is in regards to the melatonin that you were talking about.
Yeah.
What do you think in regards to taking melatonin every day for kids and at what dose because of the concerns for disrupting the hormone receivers, and also using it as a antiviral protector during this time?
Yeah. So first of all, just to go back, one of the things we did with our melatonin too is to create what they referred to as a liposomal product. So one of the things you'll see about our products too is that we actually made them liposomal. And we made them liposomal because one, it helps them to survive longer, so you get a better bioavailability and it get absorbed more. So all the products we were looking at specifically to be absorbed better and to last and to have a higher level in the body rather than getting broken down before it gets there.
So it actually lasts through the night for the kids.
Yeah, well, and particularly just to make sure that you're getting something in, because if you're taking something that's chewed up and it doesn't get into the body, then it's not helpful. Yeah, and the hope is that we get a longer half-life in the body too based on it. The data on melatonin in kids is that it's actually quite safe. They've looked at really high doses of this, up to 10 milligrams, even in prolonged periods of time for months, and have not seen any negative effects of melatonin on the hormonal changes. The second part to that is that melatonin should be used in lower doses for longer time rather than using it as a sleeping pill. So its effect, there's about maybe 30% of the population that has what we call a hypnotic effect for melatonin. I mean, it makes you sleepy, okay? The idea here is to actually change your sleep pressure, which is what your melatonin levels. And by getting the melatonin in every night at a low dose, as little as 1 to 3 milligrams, and actually in kids, higher doses may actually make them more awake. So low doses of this long-term at night are actually quite helpful for them. And the other component of this that's really important is there's everything in the world that's going against our sleep pressures. There's electronics, there's phones, there's the television, there's the pressure of school, there's trying to get your homework done, all these other things that are throwing off that circadian rhythm and making sleep harder for kids. So the fact is, if we can have a little more balance in their sleep pressure by a little bit of melatonin every night, it's safe, it's well tolerated, it's been studied over and over and over again, and it's been shown to be proven effective. The biggest downside is if somebody's using it, is they say, well, I tried it and it didn't work, because they think of it as a sleeping pill. So they tried 1 milligram, it didn't work. I tried 3, it didn't work. I tried 5, it didn't work. I tried 10, it didn't work. That's not how it's supposed to work. You want to take a low dose every day and give yourself at least 2 to 6 weeks for your kids to see some improvement with this. The question of whether it helps, particularly in the COVID era, is a tricky one. there's not very much that you find that actually shows melatonin to be beneficial from an antiviral kind of standpoint. But the one thing I will say is during COVID, good sleep, good stress reduction, and good regular sleep through the night helps us to be healthier. So I wouldn't put it as one of these things that you could say, oh, if you take melatonin, it's going to help you clear COVID. But the healthier you are, the more likely your child will deal well with COVID. Of all the things that are out there from a herbal and supplement standpoint that COVID seems to be most, affected by, it's probably zinc. There's some in vitro studies. There's been multiple studies showing zinc helping in influenza, multiple studies showing zinc helping in colds, but it does seem to decrease the viral penetration in vitro studies with the use of zinc. So zinc and maybe some vitamin C are probably the things that have been most helpful with this. But being healthy is the most important aspect of it. Good. Sorry, that was a bit of a long answer, but did you have another question? Or did you go away?
Oh, I'm here. I had to go and talk to the children that live in our warehouse currently because they're doing homeschool. That was going to be my next question is what are the recommendations out of the Little DaVinci products that you have? What are you recommending for COVID or antiviral products for all of them to be on every day?
Yeah. So the thing, if someone was trying to look at the things that are out there to take every day, really there's the only two that I would sort of put out there, and these are basically just good products to take. One is to take the zinc. The zinc seems to be helpful. 20 to 50 milligrams a day are usually what we're looking at with that. And then there is some suggestion that vitamin C may be helpful too. And I know we're on a supplement line here, but if I have to tell people, and I have to say this because I'm a Western medicine doc, the vaccine works. Okay, I get tons and tons and tons. As an integrative doc who works in the Western world, I have so many people that come in to see me because they know I look at the world differently. So there's certain vaccines that I would look at and say, well, your child probably doesn't need this one right now. And, and this one sort of hits or misses. But we do know that the use of this vaccine is quite safe and has been a profound, to be honest with you, it's way better than I ever thought it was going to be. When they first said they're coming out, I was like, nah, I'm not sure this will work, okay? And because I'm always a little skeptical of every therapeutic intervention, be it medicine or supplements, they got to prove it to me. So I don't want people to leave something like this thinking, oh, I'm just going to do, my 16-year-old son, I'm just going to do, zinc and vitamin C. If they have the opportunity to get the COVID vaccine, it is a good vaccine for children to get.
Another question for you is in regards to anxiety. We're seeing more and more children with anxiety issues at younger ages. I have a 6.5-year-old. I'm like, what do you have to be anxious about? You're 6.5. You're supposed to be playing Barbies and dolls and Legos. What is the issue here? And they're seeing it more and more in case studies across clinics, in schools now, even before COVID. So could you talk a little bit to that and the L-theanine?
Yeah, I completely agree with you. So, when people talk about anxiety and COVID, as I said before, anxiety was there way before COVID was. These numbers have been off the chart for years and years and years. As a matter of fact, just before, about 3 years ago, before COVID came out, the World Health Organization came out and said anxiety and depression is the greatest epidemic and disability in the world, okay? When we used to look at this years ago, 10% of kids, 5% of kids might have been diagnosed with anxiety, might have been having some anxiety treatments of some sort. The most recent data is it's probably at least 30%. At least 30% are not only dealing with anxiety, but actively being treated for their anxiety. The adult population is now probably approaching 60, 70%. I mean, the numbers are just absolutely off the chart. So as an integrative doc, I take a multifaceted approach to this. From an herbal standpoint and a supplement standpoint, it's very simple and straightforward. First of all, omega-3 fats absolutely need to be on omega-3 fats. The data on omega-3 fats and neuropsychiatric issues, whether it's anxiety or depression, whatever, there's numerous studies that have shown the benefit of omega-3 fats for this. For those of us particularly who live in the north, vitamin D. Low vitamin D levels classically are associated with seasonal affective disorder and other neuropsychiatric issues. The L-theanine is a beautiful one. L-theanine comes from green tea. It's the calming part of tea. I say green tea, it comes from tea just in general, but it's the calming part of tea. It has very little in the way of side effects. You have to usually take it a couple of times a day because most of the herbals get chewed up pretty quickly. But it's a wonderful one. And the nice thing about our Little DaVinci product is it tastes like fruit punch. It tastes excellent. It's really, the kids love it. And you can get a therapeutic dose. And I know when I do my blogs and stuff, I can't use terms like therapeutic, but I think when I'm talking to you guys, you understand. That when you take a dose of it, it's actually set so that it does actually give a dose that would be considered effective based on the trials. Other things, the magnesium, we have PhysiMag. Magnesium can be used as a nice calming herb or supplement that's out there. Our PhysiMag is probably similar to the Calm product. You might have, our L-theanine is called Calm, but the PhysiMag is called PhysiMag, and it's a very similar product to what you get when you take Calm, the other one that's there. I work a lot with mind-body therapies. I have a lot of the kids doing breath work, stress reduction techniques. But here's the simplest way to do it is you say, all right, we talk about mindfulness. We know mindfulness works, right? Well, how do you get a 6-year-old to do mindfulness-based stress reduction? It's like impossible, okay? I've been meditating for 30 years. I'm the world's worst meditator. As soon as I start meditating, my brain goes here and here. I'm like, it's crazy. I'm still 15 in my head. So but it's actually simple. What you do is you take a mindful approach to your life. So when the kids sit down to have breakfast and you have a bowl of fruit and you have a donut and you say to them, which of those do you think will help your anxiety to be better? And the kids will go, oh, the fruit will. They know, you don't have to get crazy with diets and everything else. They know intuitively what to eat. So you have them start every time with the healing food. So it might be they eat their grapes or their banana or their orange or their granola or whatever, and then they have their donut. But we always, always, always start with the healing food. They come downstairs and there's a slice of pizza, my other favorite, and there's a salad. And you say, but so instead of going, oh, I'm just going to eat my pizza, you say, which of these do you think is going to help you with your anxiety? And so what happens with that is not only do they start taking up and eating more phytonutrients and polyphenols and beta carotenes and lycopenes, all the things that we know that help to improve neuropsychiatric outcomes, it also gives them control. It's a mindful approach to life. So they're going to watch Netflix. Okay. So, SpongeBob is coming on or something, and so you're like, okay, what do you think would be good to do before we do SpongeBob? Do you think it'd be better if we went and walked around the house a little bit? Or do you think it'd be better if maybe we did a few stretching exercises for 5 minutes, keep it in that little 5-minute window and then watch SpongeBob? Or do you think it would be better just to start playing Call of Duty for the next 12 hours? Okay. So what you're trying to do is take little tiny windows, and those little windows are actually very effective. The mindfulness studies show that as little as 3 to 5 minutes can make a difference. But kids can't meditate very well that way. So what you do instead is you start engaging them in this mindful concept. And then add in a little bit of L-theanine, get them on the omega-3s, keep the vitamin D good. And so many kids get better. I mean, so many kids improve with it. That was a long explanation, but I'm sort of giving you more than just the herb since it's your kid, so.
Oh, no. I appreciate that. Another question for you is in regards to autoimmune. I hear from clinics constantly that they're seeing a very large spike in autoimmune cases within children. Can you speak to that a little bit and how the Little DaVinci products help support the kids' systems while they're going through treatments?
Yeah, no, that's a great question. So the concept of autoimmune, and it's hard because the question of immune or autoimmune or inflammatory, that whole inflammatory nature is actually what we're really looking at with all of this. And people always say, why are we seeing more of these in children? Is it because they're having, more different food exposures? Are they having more stress in their lives, which like what happened with me, that brings out the immune system? So, or the immune mediated things. So the Little DaVinci products that we've brought out there, we're actually looking specifically at trying to lower the inflammation, and particularly looking at things that we know have played a role in the immune response and the inflammatory response. The omega-3, the vitamin D, the little D-Light one that's there, another one that we looked at with that. So those are a couple of the products that we said, okay, how can we really enhance the immune response? The same thing with the zinc. Zinc has been looked at for a long time in terms of good immune response, and how your body clears viruses and what have you. So those are a couple of the different products that we really targeted as an immune or anti-inflammatory type approach. There are adaptogens, there are other things that are out there that you can use, but we didn't target a lot of the adaptogens yet, because that was something that we were going to look at down the line. Right now, we're looking at what are more of the deficiencies. Because think about it, the question is the immune response off because of external stimuli that are causing it, whether it be foods or whatever stress it causes? Oh, hello, hey Brandy, is that Brandy?
Hi, Dr. Han.
Oh, how you doing? Okay. So anyhow, what we did is we said, okay, here's the, these are the external factors that are playing a role. But why has it gotten worse more recently? What are the things that we're missing in our diet, for example, that we know are deficiencies that may be helpful to replace? And that's where it comes back to the omega-3s, the zinc, the vitamin D, some of the B vitamins, those types of things that can be helpful for the body's normal good immune response, to balance everything out.
So another question is, you talked about migraines. You're obviously seeing very sick children there at Dartmouth when they're coming in. What are you seeing as the underlying cause of the migraines? And then the, essentially the function in the body that's causing it in small children, and then the dosing and treatment and what you're looking at that's being the most helpful for kids?
Yeah, no, that's a great question. So let me just sort of lay this out a little bit. Kids come in to see me with their headaches, and universally they say they've tried everything and nothing works, okay? You see that all the time. Everybody's afraid it's a brain tumor. Everybody's afraid, it's their eyes or sinus infections or something. Those are tiny, 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 tiny percentages. There's 5 essential headache causes, triggers for headaches, okay? One of those is stress. If you look at the national studies on this, 60 to 100% of people will tell you that anxiety and stress are the primary trigger or the exacerbator of their headache. Number 2 is insomnia. About 40 to 60% of kids who are dealing with headaches have insomnia. And that's partly because stress is the #1 trigger for their insomnia. So that plays a role. Number 3 is food. And everybody makes the mistake of saying, oh, it's pepperoni or it's Chinese food or it's some, MSG or something. No, it doesn't. People would know if that's the case. If you eat pepperoni and get a headache, that's what triggers your headache. But most people say, well, I don't know what's triggering it. Well, it turns out that it's actually either skipping meals or having high carbohydrate loads, lots of starches, which cause lots of blood sugar swings. That's probably the more common reason. And think about this for a second. Kids have to be at school sometimes, particularly my high school students, at 7 o'clock. They're catching the bus at 6:30. They're grabbing maybe something on the way out. The school lunches are now down to 12, anywhere between 10 and 15, maybe 20 minutes. Some of the schools, you can't even walk from your class to the lunchroom and get back in the time, so the kids just don't eat. So they go hours and hours and hours without eating. And that makes up sometimes about 40, 50% of the students or the patients. Dehydration and musculoskeletal pain, so pain in the shoulders, back, and neck. And those are the 5 primary causes of headaches. So if I tell you that, then I would ask you, Where does the medication Topamax affect any of those 5 things? Where does Neurontin affect any of those 5 things? Where does amitriptyline affect any of those 5 things? So we turn around and say, why aren't any of the medicines working? Because they're not actually going after the areas that are causing the headaches. So when we do this from an integrative standpoint, we target all of those 5 things. How do we look at helping with your stress and your anxiety, and how do we improve your sleep? How do we look at your food? But importantly, there are certain herbs and supplements that have specifically been shown to work, not like the medicines, which haven't been shown to work. There is not a single drug that's been approved for chronic headaches in children that's been approved, okay? Yet we use them all the time. But magnesium has been shown to decrease headaches by 50%. Butterbur has been shown to decrease headaches by over 50% in some of the studies, maybe even up to 80%. Good sleep with use of melatonin and L-theanine tends to help to improve this. And there's actually a recent study that came out that showed omega-3s helps to decrease headaches. So the fact is, those are all things that actually have information and data that show that they're helpful. And using those in treatment is how we actually approach this. Does that make sense?
What about adding in a curcumin product in regards to that?
Yeah, great question. So I love turmeric. Okay, turmeric's one of my favorite herbs, and we actually had a lot of talks about this with when we were looking at our products lines that we make. We actually have one that has some curcumin in it, some turmeric in it. It's the GI one. My primary use of turmeric is it's used as a potent anti-inflammatory. Okay, and when I'm looking at it, I look at it in my GI patients. So our belly pain patients, our inflammatory bowel disease patients, some of my gluten patients, my celiac patients, we use a lot of turmeric for this. I also use it in my chronic pain patients. So I love the use of it in my arthritis patients, my fibromyalgia patients, my it's called EDS or Ehlers-Danlos syndrome patients that have these chronic pain phenomenon. I love the use of turmeric.
That's what my daughter and I have, so we know it very well.
Yes. And so the key to this, though, is that if you're going to use it, you have to have a form that gets absorbed. So if you have GI problems, it's fine to take just regular turmeric or curcumin. But if you want to use it for your muscles or your joints or headache pain, you have to have either a bioperine, a black pepper, something that actually increases the absorption of the cumin. So we at DaVinci have actually had discussions about trying to make even a chocolate flavored one that we could sort of have the kids chew every day. But we ended up going with a similar product to what we use in the adults, which is it's a GI anti-inflammatory one that the kids could use as a powder and mix it in their drinks to help with other pain phenomenon.
And is that because of absorption and doing it that way as a powder versus like a chewable?
Yeah, it's mostly I think the things we haven't done. One, chewable turmeric, like chew in your mouth, is just so spicy. It's just so spicy. Okay, it's really hard to take. That's why we were thinking about whether we did it with chocolate. But the other part to it is you can do capsules, but the kids can't swallow the capsules.
Right.
And tinctures, it's really hard to get enough cumin or turmeric into the capsule to get it to work. So we opted instead to use, and this is one of the times when we did a bit of a proprietary blend for it. As I said, I'm not a big proprietary blend guy, okay? I like to do things based on just the data. But as we looked at what we could get into kids and help them with their GI tract and help them with their systemic inflammation, we said, okay, let's put these products in and let's put enough in that there'll be a therapeutic level if they can get the dose in. So, yeah.
Apologize for that. My phone was going off. Okay, so does anybody have any questions for Dr. Hahn? I've kind of picked his brain on everything that I had my list on here based on his conversation. I would love input from anybody.
There we go. Maybe you can hear now better.
Yes.
I actually have a question. I'm on the sales team, And I sometimes get asked, these supplements are for ages 4 and over. Is it, appropriate for under 4 or 4 and over?
Yeah, no, it can be under 4. You get into all of the issues of what we can label it as, and on-label, off-label. It's like medications. I mean, almost none of the medicines we use are approved for kids. They all say not for kids under the age of 12, and yet we use them on everybody, okay? It's more just a label thing. So if somebody comes in and says, listen, I want to use the powdered probiotic, which is actually, and Brandy might say, Matt, don't tell people this stuff, but the fact is, we created that powder specifically for babies for colic and what have you. So the preps are okay for under the age of 4. If obviously if you have a 3-year-old who's coming in with chronic headache pain, they need evaluation by a neurologist to make sure there's not something else there, and you wouldn't just put your child on butterbur or magnesium with that. But they are usable in that age group if it's needed. Yeah.
I will tell you, Hollis, from firsthand experience, she could swallow it. She was taking it. And if I could hide it in the bottle, even better.
Yeah. Well, see, that was the thing. That's the beauty of the probiotic.
The powder.
Well, yeah, and the other thing about the fish oil, the omega-3, is the one thing we always tell people is shake the bottle, because there's the flavoring sometimes settles a little bit, and you don't want to just get the oily part. But it's only 1 teaspoon, and 1 teaspoon has 1,200 or almost 1,300 milligrams of omega-3 fats in it, which is amazing. Okay?
That's great.
That's a totally therapeutic dose for anybody. So instead of sitting there trying to get 2 or 3 or 4 teaspoons in, or having to eat a whole bottle of gummies or whatever, and you can put this in a smoothie, you can put this in, throw it in anything they're eating or drinking every day. It's,
syringe and just pop it.
Just pop it in. It's 1 teaspoon. It literally is. Probably, and that was our goal, because the other products that I was looking at, either A, tasted horrible, okay, or B, to get the amount you needed in, it was 3 or 4 teaspoons or a tablespoon, or it was in a form that the kids didn't like the way it came. And I said, listen, 1 teaspoon that you can put in anything. We did this at one of our shows where we put it in the smoothies, and that you couldn't even tell it was in it. I mean, it tastes. It's technically like a citrusy flavor or something, but it actually tastes like bubble gum. And so that's the beauty. If a mom says, I want to give this to my younger kid, you don't need 14 teaspoons of it or whatever to get the effect of it. If you want the probiotic, you get a beautiful amount of probiotic. If you want to take some zinc and you want to get a therapeutic zinc, 1 little chewable lozenge, or put it under your tongue lozenge, which tastes like a Smartie, has 23 milligrams of zinc in it, and most of the other ones, it's 2 or 3 lozenges just to get 16 milligrams in it. You can't get the sulforaphane. There's no other product on the market that you can get the broccoli extract for children with autism. You can't get the butterbur in any other form. So these are really, they're unique. They're good, they're clean, they're targeted. This isn't, and again, let's go back to the why, okay? Why did we do this? So if you're walking in selling this to somebody, and I'm not just saying this because I want to sell product, and I know Brandy's like, don't say that, Matt. But the point is, my job is to change the world. My job is to change pediatric healthcare. And we developed this line so this will change how things are done. And you walk in and you have to sell this to somebody, you say, listen, this doc came up to do this because he's trying to make the stuff work for children. This is not me, and I'm not going to talk about other, names of products, but, I have parents walk in and say, look, I got this vitamin. It has everything you said in it. And it has 1/100th of everything I said in it. And they spent $75 for that bottle of stuff. And it makes me so angry when we're really not doing what's good for our kids, and that's our whole goal here.
One more question for you, Dr. Hahn, is in regards to, because you brought up autism and with the broccoli extract, is there any new information that's coming out in regards to the treatment of autism? Can you talk a little bit about the broccoli and why it is so effective?
Yeah. So the autism spectrum stuff has just been, I mean, it's crazy in terms of the numbers that have been diagnosed. You know, they're looking at about 1 in 60 children now with autism spectrum. Exactly why it's happening, we're not 100% clear. People talk about food, they talk about, you know, environmental exposures, they're talking about genetic links and all of these other things that are there. Probably the biggest discussion, or one of the biggest discussions, is this concept of the hot brain, that basically this is an immune or inflammatory condition that happens in the child's brain. And very similar to what they see when they talk about patients with like Alzheimer's. So actually they're treating some kids with autism with Alzheimer's type medications. So very often what we're trying to do is we're trying to work with that gut-brain connection. And that's everything from the probiotics to the food. And that's the real idea behind the sulforaphane. Sulforaphane really came to fruition because this concept of it lowering malignancy in patients who have, you know, broccoli and cruciferous vegetables, lowering malignancy and decreasing inflammation in the gut. And so the use of the sulforaphane, the concept is to change that inflammatory response so that it decreases the inflammatory response in terms of the autism kids. One of the hardest parts with autism is that there's so many things that pop up all the time, and yet a year later, everybody's like, oh, you know, nobody's talking about it anymore. Because it's such a heterogeneous type condition. The single most important thing with autism, and this isn't supplement oriented, is, well, just so you know, so what we do for autism, we do omega-3 fats, we do vitamin D, we do zinc, because there is, if you block zinc receptors in the brain, the animals act as if they have autism. We do the sulforaphane, and I think I said B vitamins because they've shown that low B vitamins are low in many of these.
On MTHFR.
Yes, and so but the single most important thing for patients and families who deal with children with autism or have children with autism is that they all have a gift. Every single child who has autism is given a special gift. It's in there, and they are really great at something. Numbers, music, reading, writing. They can do something that nobody else in the world can do. And so the first thing I try and do with my autism patients is find out, well, what is the gift? Because once we have the gift, we can work with that as a therapeutic intervention.
And bring it out.
Then we add in all of the other pieces so that we can make that the best we can for them.
Okay, great. Well, I really appreciate your time, Dr. Han. I found it extremely informational. I am sure that our team will love it as well, especially now that we'll be able to share this with some of our customer base. And I appreciate what you're doing there with the kids. So thank you.
Well, thank you. And tell your team that this is really the opportunity to change the supplement world, okay? And they should be telling this to the docs when they go in. If you're selling it to them, that this is the reason this was put together, okay? And that's what we're trying to do. And that this is really geared towards the best possible care for the children.
Well, and we'd love to have you come back sometime and talk further about a specific product or a condition. So thank you very, very much for your time.
Thank you, guys. Take care, everybody.
It was a pleasure meeting
Dr.
you.
Han.
Bye.
Bye.
Thanks, guys. Hey, Brandy, you good? I don't know if she heard me. I see her there still. Okay.
Still there.
All right, I'll talk to you later, Brandy. Okay, I'll send you an email.
Can you hear me now?
I can hear you now.
I'm still here.
All right.
You didn't give me heart failure yet. A couple moments I wasn't